Okay, here we go. I'm admitting those in the waiting room.
Good afternoon, everyone. We're just going to let folks kind of join here for the next minute or so, and then we'll get started. All right, I guess the bells have stopped ringing, so we can probably get started. Good afternoon, everyone. I'm Jason Podropsky, the Interim Vice President for Research and Graduate Studies, and thank you for joining us for our hopefully last COVID-related RGS Town Hall. I think, hopefully everyone's feeling a little bit more positive about the pandemic now than maybe you have in the past. I think many people are feeling hopeful that the end is near. And so I want to first thank you all for your efforts during the pandemic to keep your research programs going, to keep campus active, but doing that while prioritizing the safety of our community. I'm really proud of our efforts, and especially the fact that only a handful of PSU researchers got COVID that we know of. And of those handful, none of them spread in our community. So that's because you all follow the rules and we're very careful and safe. And I thank you for that. I'm sure you're all exhausted by this point, as I am, with not just the pandemic, but it's close to the end of the term. It's summer's coming around. And I don't know about you, but trying to adjust to not avoiding other people is actually requiring a lot of energy for me. So I had my folks come to visit me this weekend, and it was both great. I gave my mom a hug for the first time in a year and a half, but it was super stressful because nobody was wearing masks. And every now and then you're like, oh my God, where's my mask? And I just use that as a reminder to everyone and to myself that different people are going to adjust to this new world order at different speeds. And so if we can all remember to be patient and understanding with each other on campus and in our buildings, maybe if somebody's not wearing a mask, remind them that they're on campus, they need to wear a mask. Those sorts of things. I think a little understanding will go a long way. So hopefully as a community, we can support each other through this. It actually does seem to take a bit of energy to get used to readjusting to something more like normal life. The purpose of the town hall today was really to help share with you the how to safely conduct research this summer as we transition from the current situation towards looking to fall term, where we're supposed to be on campus, and back to somewhere close to normal operations. And also to surface any concerns and questions you might have that we aren't able to answer today. We're hoping to culminate all of this in an updated website with FAQs by next Monday, and hopefully on Friday, Sean McGillis, our communications director extraordinaire, will be putting out an RGS bulletin with a lot of the information that we share today in it. So you can look for that on Friday. Okay, so I'm sure that you've all heard that we are going to return to quote unquote normal operations, or we're going to return to what people have been calling BC, before COVID times, operations sometime in September. The official date that President Percy put out was September 7th. If your job is required to be on campus in order for it to be conducted, that you'll be expected back. But that leaves us a lot of space and time between now and September, when a lot of us are very busy with research. So we wanted to make sure that we got information out to campus about what to do between now and then. Transitions are almost always the hardest, I think. So starting on Monday, June 7th, we are going to reduce the research operation level from level 2, which is where we are now, down to level 1, which means that we will reduce our some of the restrictions that we have on things that can be done on campus. If you'll recall from a year ago or so, we came up with these campus operation levels, research operation levels, and you can revisit those. They'll be available as a link on the website by next Monday to see what those levels look like. So what I wanted to do first is give you a rough idea of what that means. What does it mean to go to research operation level 1? For one thing, I think we know a lot more now about how to do this than we did when we made these operation levels up. And so we've updated them a little bit to make them more consistent with what we know will work. So I want to start by saying first that remote work is still encouraged. And so if you can do your work remotely, there's really no reason you shouldn't stay at home and continue to do that work. But if you need to return to campus to do your work, that is now possible. And so I want to go through, for those of you that have been doing research, you know it's been possible, but for other folks that just want to go to their office to check on things, they've now authorized folks to go back to their office for those sorts of reasons. So let me go through and just start going through some of these topics, and then we'll open it up for questions after that. First, I'm sure most of what's spurring this change in condition is the vaccination status of the state of Oregon, specifically Multnomah County and Washington County. And so there's lots of questions about vaccinations, and I'm not going to go into all of the policies and things that PSU has come up with because those were covered in the webinar last week. But I do just want to encourage anyone that's eligible to get vaccinated to please get vaccinated. PSU is now running vaccination clinics, and I know SHAC has vaccinations available, plus there's all the other normal routes that you can go through. And I believe that Sean is going to put a link in the chat about the coronavirus response page that shows vaccination policy for PSU. I want to remind you all that you cannot ask our employees or our students about their vaccination status, especially as it relates to their activity as PSU employees, okay? So we're in this weird gray area where in the fall, we're going to be requiring folks to at least attest whether they've been vaccinated or not, but we can't really ask them. I do want to make the point, especially for those of you that work in lab groups or field groups, that you may know information. Folks on your team might volunteer their vaccination status. And I think that if people want to volunteer that information, you should be able to use that information to make good decisions based on CDC and Oregon Health Authority guidance when you're out in the field or doing things. So just keep that in mind. However, when you're on campus and indoors, we are still going to have a mask face covering policy independent of your vaccination status. Okay, so when you're on campus in public or common use areas, we should be wearing a mask. The only time when you're able to take your mask off is when you're in your office by yourself. All right. Okay. Some of you may be wondering what to do about getting authorization to do research. So we're still going to track research requests through the same return to research process we've been using. We don't want to change anything. So you still need to put in, ask for access for each person in your lab and tell us where they're going to be working and when they're going to be working in general. We are not going to be reviewing the purpose for that request for access with as much rigor as we were before. Mostly what we want to do is have a record of what folks plan to do, where they'll be, and when they'll be there, so that if we have to do contact tracing, we have that ability. I also want to make the point that for students, this is absolutely critical. If you want students to have access to buildings, they're going to need to go through this research, return to research request process until the fall. All right, I'll get to building access here in a minute. In terms of the COVID safe policies and conditions, they're basically the same as they have been, with a little more relaxed details on the density of people you can have in buildings. So we're still physical distancing 6 feet apart. We're still wearing masks when we're on campus and inside. We still would like you to conduct pre-shift symptom checks and stay home if you're sick. Don't come to work. And we still would like you to continue following the cleaning and disinfection protocols that we've been following. Where the real difference is that we're not worried about density in the buildings as much anymore. So we're going to relax those density limits, and you can have multiple people in a lab if you'd like, as long as you can maintain those physical distancing characteristics of 6 feet, and everybody's wearing a mask. And remember that right now, I believe the rule is up to groups of 25 can meet indoors as long as the room is big enough to allow physical distancing and everyone's wearing a mask. So those are sort of the new conditions as I understand them. Building access. So I've been told that normal building access will be available to all faculty and staff with a PSU ID. So if you had access to a building during pre-COVID times, you should be able to enter that building to get into your office or lab. However, for students that are still going to be restricted, and that's why it's really important you go through the return to research request process, and that's how we're going to control access through the summer until the fall. And then when we return to campus on the fall after September 7th, we'll revert back to, the plan is, at least now, to revert back to getting access to buildings through your normal departmental channels. Right? So keep that in mind. Next is human subjects work. I know this has been the thing that we've limited the most during the pandemic. So I'm sure there are many of you that are curious about this. So we are ready to return to most face-to-face human subject work now, as long as, of course, it's approved by the Human Subjects Protection Program or the IRB, depending on what's necessary. And it's been reviewed and approved by the Restarting Research Committee, because we need to still go through that process. So what this means is if you're doing interviews or other methods that don't require you to manipulate the human subject, like do a medical procedure or something, you can resume those studies. If you do have medical procedures or other things like that that require like close contact for long periods of time, especially if PPE can't be used, we really should, reach out to us and ask, and we can help provide some guidance on things like that. Remember that when working with vulnerable subjects, to really closely adhere to CDC and OHA guidance. And if possible, I would suggest for all of these things, since it's summertime, do them outside if possible. That just means that your risk is even lower. So just some guidance there. Again, you'll want to conduct pre-shift symptom checks for both the researchers and the participants and make sure that everyone's feeling well on that day. And then one question that's come up that I'm sure there's at least a few people that are curious about is, can we require our study participants, voluntary study participants, to be vaccinated in order to participate in a human subject study? And the answer to that is yes. If you want to make that a requirement for your participants, that is appropriate. However, you can't ask for any sort of written documentation. You just need to have them attest to having been vaccinated, right? So if they can verbally tell you that they've been vaccinated, that's as far as you can go. You can't ask for any paperwork. Okay, so that's the human subjects work. The next one is fieldwork. I'm sure everyone's thinking about this right now, especially with weather like this. It makes me itching to get out in the field. The biggest issue that we've had in the past is folks thinking about traveling to field sites. I'm happy to say you no longer have to caravan single people in a car. I think if you want to carpool, that's great. We're suggesting that everyone wear masks and that you keep the airflow in the cabin high, either by having the windows down or using the AC, get good airflow in there. And again, make sure everybody's well and not showing any symptoms. And then it's hard to give good guidance for field studies because you never know what's going to happen out when you're on site in the field. So I'll just say this: for decision making when you're at a field site, use your common sense and follow the OHA and CDC guidelines when appropriate, and I think you'll be fine. So there's that one. Travel. So a number of people have contacted us recently regarding travel. So travel is essential travel is possible with supervisor approval. The person who decides whether or not it's essential travel is the supervisor. So if you have a grant and you say that this work is essential to the work of your grant, that would be considered essential travel. And you would just use the normal travel authorization process. RGS does not need to approve travel. So you can just go to visit the Viking Travel website, and they have updated guidance there for you. Remember that if you're doing research, if your reason for travel is research, we need to know who's going and what the research is so we can keep track of it and we know where folks are going, but we don't have to have any part in actually approving the travel itself. Remember, if you're traveling out of state, that you need to review the specific state, county guidelines. And if you're traveling internationally, which seems to be becoming more and more possible each day, you're going to want to look at those COVID requirements very carefully and realize that you may be forced to shelter in place or self-quarantine at your place of destination and when you return, depending on what the local conditions and rules are and CDC guidance and everything else. So just keep that in mind. And then last, I will say, and then I'll shut up and let you ask questions. I just want to say that, I'm very hopeful that we're headed in a good direction. Every day, the number of cases seems to go down and down, but we are not anywhere close to the level of vaccination that they predict we need for herd immunity. So, and there are variants out there. So we do need to remain somewhat vigilant and be ready to return to more restrictive measures if public health conditions change. So it's important to have this discussion amongst yourselves of what you're going to do if things change and how we're going to go back to more restrictions. But hopefully we just are going to move slowly towards better conditions and to reopening and be back to whatever the new normal is going to be come September. So, all right, so that's what I wanted to cover. I think that covered most of the pre-submitted questions. And I'm going to open this up so I can see faces now, because I couldn't see that. And if you have questions or whatever, I can look in the chat here. So, okay, I see one question about the number of people. So one person put in, they believe the limit's gone from 25 to 50 people with physical distancing, but Jeff, are we being more restrictive on campus than the county guidelines, or are we just following county guidelines?
So currently we're going to stick with 25 people indoors.
Okay.
We're shifting over to outdoor settings to 25 people indoors, 50 people to outdoor. And we are actually reviewing where we can loosen those restrictions as well, but that will be at a later date.
Gotcha. Great. So thanks for clarifying that. I see you already did it in the chat. I'm catching up now. So Melissa Hafner, Melissa, do you want to unmute and ask your question? You can hear somebody else's voice and not mine.
Thank you so much for this news. I'm really excited to do human subjects research over the summer. So I was wondering if the process is going to stay the same with that Google sheet or if there will be a different process.
It's exactly the same. We don't want to change the process and make people learn something new. So we're just going to collect the same information. You maybe don't need to put as much effort into justifying why you want to do it now. Just say, oh, it's for a grant or it's this project or whatever. But mostly what we're interested in is just keeping track so we know where people are. So if we have to do contact tracing, that we have that capability to help out with that.
There were a couple of follow-up questions in the chat on that as well. As if it's on a 2-week cycle still for new submissions and the time frame for approval.
Yeah, I think that the 2-week rolling deadline has been working pretty well, and we'll continue that. I think normally we get them in on Friday and we're given approvals by Wednesday of the next week at the latest, I think is the latest I've ever gotten to them. So we'll continue that. Of course, the sooner you get these in and get all of that planning done, the less likely it is somebody's gone on vacation and something gets hung up that way. So I would suggest trying to get most of this stuff early in the summer so that we can kind of get that work process done. But we're always, and you can always put in ad hoc requests. If something comes up and there's like, oh my gosh, I just found out I have this opportunity for this 24-hour window to go to such and such hatchery and catch something, then, you know, let us know, and we don't want to hold anybody up. We just want to make sure that we have a good idea of where folks are, basically. Does that help?
It does. Oh, sorry, one last follow-up. Does
Yeah.
the requests all have to go through the chair?
Yeah, we're going to go through the same process. The chair can collect them and move them on, because that way it's been working pretty smoothly. The chair sends them in, the deans know when the chairs send them in, and we're able to process them pretty fast. And then I'm looking here, I see a question about that I'm generally speaking about researchers, but when you say it's preferred that you work from home, does that apply to September for staff? So this is the information we're providing today is just for summer, right? There's going to be different guidance that comes out in the fall, and I think there's going to be probably lots of conversations about what people's mix of remote and on-campus work will look like in the future. I know many people are interested in having some mix in their life, and there's going to be probably discussions between supervisors and employees on how well that will work out. So I would, if you are curious about what your life is going to look like in the fall, I would reach out to your supervisor and start that conversation. I guess now at any time. Let's see, I'm looking in here. Oh, I saw one question about non-student researchers, high schoolers, volunteers. Yeah, you can have those folks come onto campus now, just like we used to in the past. Just remember, if they're not a PSU student or employee, they need to fill out that liability waiver form and have it on file. And then they will need to do the COVID training so that they know our rules and policies, and they'll be held to the same rules as everyone else on campus. But yeah, we can go back to having a much more open campus, I think. Let's see, Charles asked if there's any different procedures involved for international research. We have not really talked about international research at this point yet. I'm not even sure how many countries are allowing US travelers now. I know Mexico is allowing travelers again, and some of that has to do with whether or not you're vaccinated. So you may have to provide proof of vaccination for that sort of stuff. Do you have anything in specific in mind, Charles?
Well, I have collaborators who are in Sao Paulo, obviously not a great COVID spot, and we kind of froze all face-to-face stuff, right? So, you know, human subjects. So I just wondered if at any point, if we change our rules here in terms of what's permitted in terms of human subjects and distancing and masks and all that, whether that would apply in Brazil too for my projects. I'm not planning to go anytime soon.
So you mean for PSU researchers traveling to international?
No, they're Brazilians, but they work on projects of mine. Or not paid. Well, actually, one of them is paid currently through June, but we haven't been doing anything. So I just wondered how that fit in.
Right, but they're in Brazil, right?
Yeah, they're
They're in Sao
Brazilians
Paulo.
who live in Brazil. And
I guess they need to follow whatever rules are going on in Sao Paulo.
Right, they don't have such researchy rules, right? They have more. They don't even hardly have human subjects in IRB in Brazil, Jason. It's really bizarre.
Yeah. No, I know. Now that kind of stuff will be followed. Obviously, remember, human subjects follows the institution where the money goes, not where the location.
No, exactly, and hence my fuzzy spot then, because
yeah. I guess I would need to know a lot more about the specifics of their situation, but we're happy to talk about that and try to work something out offline if you'd like.
Sounds good. I'll reach out when I know more.
All right, thanks. So let's see, Alex asked about what are the plans for opening things up further, like reducing the need for physical distancing. So obviously we've got to follow the OHA and CDC guidelines. And I'm not quite sure. I mean, and Jeff Rook is here. Maybe you can talk about this. It's my understanding that come fall, the physical distancing requirements will sort of go away. Is that true, Jeff, that folks will be in normal classrooms? And
that is the current plan, and that is the plan that was submitted to the Oregon Health Authority. So obviously the Oregon Health Authority and the Higher Education Coordinating Committee need to approve what the university has proposed. They have not yet done that fully, but we're optimistic that we will have more normal operations and we will not need to have the larger physical distancing requirement that we're currently operating under.
Great, thank you.
Yeah, so kind of following up on that, like there's rumors that the governor is going to open things up, a whole lot more come end of June, early July. And, are we going to stay restrictive, like where our students have to sit far apart in the lab all through the summer? Right. So kind of speaking directly towards research and not towards teaching.
Yeah, Jeff, do you have any guidance on that? I mean, I would assume that we will follow the state, and local guidelines, the OHA guidelines. And if in June they all of a sudden say nobody has to wear masks and nobody has to physically distance anymore, that we wouldn't be more restrictive than that, would we, Jeff?
With regards to the mask piece, that's a bit more complicated right now. So we're planning on having, all the way to fall, having masks being a requirement for coming to campus. With regards to physical distancing, if we start seeing a reduction in that from the state, Oregon Health Authority, and we're in a position where we can loosen that, then by all means, we can start looking at that. One of the changes that Jason did touch on earlier in the presentation is with regards to each of the labs on campus, you can start loosening up the restrictions. So I know previously we were very restrictive and quite a bit more restrictive than even Oregon Health Authority and CDC had made statements for on square footage in labs that could be allowed to be occupied by researchers. Now we're going down to 6 feet and trying to maintain that for all of the labs. Again, if we see improvements over the course of the summer and OHA and HEC come out with more loose guidance, then we'll consider that and go that direction.
Great, thanks, Jeff. There's another question in here about vaccine requirements. So there is no vaccine requirement in place for the summer. In fact, we can't require, remember that all the vaccines are still under emergency use authorization, and so they can't be required by us. And our requirement will go into effect once one of those vaccines is actually made fully FDA approved. That's my understanding. Correct me if I'm wrong on that, Jeff. So at this point, there's no requirements for vaccination.
Yeah, and it's the attestation piece is going to be required for fall. So come fall, and once the mechanism is in place through HR, you will have to state whether you've had you've gone through that process and you're approved to be on campus. And if your decision is that you're going to, for medical or religious reasons, or a temporary deferral because it has not yet been approved, a vaccine has not yet been approved by the FDA, that's what you'll get to disclose. But we're not going to go walking around requiring people to get the vaccine. You're required to disclose what your status is.
All right. Any other questions? No? It's awfully quiet. I'm gonna, you know what? While we're, oh wait, Susan has raised her hand. Let's see, I can't see everybody. So Susan, do you want to just unmute?
Sure. What is IRB requiring for human subjects research safety stuff now? Do you have an idea of that?
I will let Shannon deal with that question.
Yes, thanks. Susan, so the IRB has not really changed their review procedures around the COVID process. So everything that is health related and return to research is all on the institution and at the RGS level. So we're reviewing your protocol submission in guidance in alignment with the OHRP regs. We haven't changed any of our requirements specific to COVID. Does that answer your question?
Yep, that's great. Thank you.
And I also see that Shelby asked if undergrads are allowed on campus this summer, and the answer, Shelby, is yes, for sure. Just make sure that you get us, that you request them through the normal process so we can get them building access. That's the most important thing. And everyone will need a PSU ID, including your volunteers. They are asking that we not just let people into buildings. They want to be able to know when somebody card accesses a building as a second way to track potential need for contact tracing.
So will the buildings be locked, continue to be locked so that we have to use our cards to get in?
Yes. At this point through the summer, my understanding is access control is going to keep all buildings locked just like they are now. The 4 main buildings, help me out here, Jeff. What are the buildings that are open to anyone with a PSU ID?
It's currently KMC, SMSU, Kramer, and FMH. If I remember that correctly. But
So
everyone will have, all full-time staff will have card access for buildings on campus. There may be a restriction in hours, but that is still being decided by the IMT. But faculty staff members will have access to all the buildings on campus. Students have access to the 4 main buildings, as Jason mentioned. And if you need access into other buildings, you just put that request in.
Cool, thanks. And I see Ken asked if this goes for high school students. Yes, and I don't want to call you out, Juan David, but Juan has joined us. He's a local high school student who really wants to get research experience. So I'm putting in the chat if you're interested, what he's interested in. And if you happen to have an opportunity, reach out to him. I think it'd be great to that he joined us today from high school and that he's interested in doing research at PSU. Juan, can I put your email address in the chat? You can unmute. Yes, okay, good. I want to put your email address in. June, do you want to ask a question?
Yes, I have one concerning that ventilation, like air conditioning, and also the janitor where they pick up garbage, or what is the irregular? I mean, once we return to campus, especially if you allow more students to get in during the summer, is that will be insured?
Can you ask that again?
For instance, I was in my office last week. I feel like the airflow in the office and in the lab wasn't as strong as maybe maybe it's too hot or something.
Yeah.
So that will be, we return to normal when we have more people to get back to the building.
Yeah, sorry. I did want to make that point. That's one of the reasons why we want to still keep tracking where people are, because they have turned down in a lot of the buildings, the HVAC airflow. And of course, if we have people in buildings, we want the highest airflow we can get. They have done a lot of work over the last year in upgrading the HVAC systems in many of the buildings. Many of them have updated filters and such. And Jeff, maybe you can say a few words about this. The other part of that is, though, June, like right now, this change in the seasons is always terrible for the HVAC systems. Like they're probably still on winter and not cooling enough or something. My office always feels like a sauna through June, and then in July it feels like an ice rink or something. So Jeff, is that?
Jeff, will you be able to tell us it will be returned to at least the normal or something like that?
So yeah, the buildings on campus have been running over the last year with an increased outside air ventilation. They've replaced and or upgraded systems to have MERV 13 filters where possible. There is a link through the EHS website that I can share in the chat that will direct you to that information as well. So, but you're right, this time of year, it does create a little bit of a havoc for the system because it can get cooler at night, a lot warmer during the day. But over the summer and what we've been operating on for the last year is upgrading these systems so that they're running at their peak performance. FPM has been going through and checking all of those locations, all of the buildings to make sure that they are operating correctly. If there are any areas where you believe it is not working correctly, submit a work order through the FPM Work Control Center.
Okay.
And that will be able to, they'll be able to do an assessment of that. But they are regularly checking those buildings to making sure that they're running correctly.
Okay, so then one more question about the safety. For instance, in the past, once a student have some either lab safety related as well as even personal safety, we're in downtown, right? So is that the number still student can get access to it, like a emergency call? That service will be resumed in the way student or faculty can call, get access to the emergency, the people can come to the whatever, even like students locked outside of the lab. Just give example, they went to bathroom, accident, forgot their phone, then they couldn't get into the lab. So do we still, when we call, the security people can come to open the door, something like that? I mean, just safety, for that physical safety purpose.
Yes, so CPSO is still on campus and have been operating through the entire pandemic. So if there are any concerns about personal safety, need to access into a building, what are them that maybe I would still recommend have them call CPSO.
Okay, good. Thank you.
Thanks, Jeff. Thanks, June. So Dean asked for me to go through, run through the timelines real quick for sort of how we're changing occupancy limits and everything. So starting a week from, so it's starting on the 7th of June, next Monday, we can go down to 6 feet physical distancing with masks. So there are no longer any limits on the number of folks that can be in a room as long as they can maintain that physical distancing. That's the way it's going to be all summer. There's going to be card access to all the buildings all summer. It's my understanding that once we get to September 7th, when we return to campus, then we'll probably return more to where the buildings are unlocked during the day. But Jeff, you might want to talk about that, but we can plan on the buildings being locked all summer long, basically.
Yeah, there's a couple of issues that we're running into. How PSU is currently able to do any form of contact tracing and notification to people on campus is through the card access system. That's the only effective way that we're able to notify individuals that if you've been on campus and we had a positive case of somebody, we are required by Oregon OSHA to notify all occupants of that building. So the only way that we're able to track that currently is through that mechanism and utilizing the card access system. We also are operating under OHA guidance that our buildings are not open to the public. So we're gonna see what fall brings. We are not sure right now what that looks like. But I would say, make sure that you have your ID card on you when you come to campus. And it may be a little bit of a challenge if you're not used to having your ID card getting in and out of buildings. But it's a way that we can ensure that our buildings are only accessed by PSU employees faculty, staff, and researchers. So that's where we're at right now. I don't know what the fall will look like just yet, but we are waiting to see what kind of guidance comes out, and then also what the vaccination rates look like for Oregon.
Thanks, Jeff. That's a great. Thanks, Jeff. That's a great reminder. Remember that we are still under an executive order for higher education, and until that is allowed to expire or revoked, we still have the buildings have to be locked down. We have to wear masks, all these sorts of things. I've been told that the governor is hoping to get guidance out in late summer for the fall because they're obviously anticipating this, but you know how that goes. Nobody's going to bank on any of good guidance, good and clear guidance coming out anytime soon. But hopefully by fall, we'll have it figured out. Other questions? No, I'm scrolling through.
I had a question, actually.
You did? Go for it.
So it's an IRB question. So when at the beginning of the pandemic, we wrote all of our IRB proposals so that we could get approval to do both in-person and remote interviewing, as long as we followed PSU and CDC guidelines. So I'm assuming now we don't need to do any other updates to our IRB because we do have approval to do those in-person interviews as long as it's according to PSU and CDC guidelines. Is that right?
Yes, Karen, this is Shannon. You are in really great shape because you have both processes outlined in your protocol. So the only thing you need to make sure is that you go through the RGS return to research approval process if you haven't done that already.
Okay, great, thanks.
Perfect. Thank you, Karen, for that question, and Shannon for asking it or answering it so well. Let's see. Alex is wondering if the reduced restrictions apply to the engineering building too. You're not the only person that has asked this question. We have been deferring to supervisors on the specific functioning of individual units, and I guess all the way up to the college level. And so at this point, I haven't been able to reach out to Rich, to Dean Corsi, to figure out if they're going to ease restrictions on getting into the building. But I do believe that since the president came out and said that folks can have access to their offices, that seems like a reasonable request. So that's still, we still need to have a couple of conversations about that. Sorry, I can't answer that more clearly right now, Alex. Okay, it's going pretty quiet now. What's the normal time that they say you have to allow for people to decide that they're going to ask a question on Zoom? Is it 12 seconds? Dawn's saying it's over.
Excuse me, I do have a question that I asked at the employees town hall, and
yeah, please ask.
With eating on campus and eating in front of other people on campus, so it sounds like if we're in rooms and we have permission to be in rooms, we have to have masks on if there's more than one person in an office. But what in the situation where you may be needing to eat?
I'm going to defer to Jeff on this. I think, I mean, we don't, the common eating areas are not open still, right?
I believe you are correct. And if you're specifically thinking about SMSU,
yeah.
I'm not sure on all the locations on campus right now, just because it is there's so few people. If you're in a shared office and you're taking your lunch break, one of the things that if you can, it's taking it outside, taking it to a location where there's less people. And while you're eating or drinking, you can remove your mask if you're actively eating or drinking. It's a common question that has been brought up and noticed in even some of the lounge areas on campus as well. We're trying to encourage people to keep masks on indoors where possible, but if you're taking a sip of coffee or whatnot, you can remove your mask for that time period if you're in a larger crowded area or in a lounge area. Or it's looking at outside locations or a larger space or room where you can be off to the side and remove your mask to eat or drink.
Thank you.
I see with the one potential place where people might get confused is if folks want to just go into their office for the day to retrieve something or work for the day, do they need to go through this return to research process? And I think the answer to that is no. If on occasion you need to go in and get something out of your office, that's fine. If you intend to start working from your office from 8 to 5 or whatever your normal work hours are through the summer, then I would ask that you go ahead and put that through the return to research process so that we have that logged in and we know that there'll be an increased density in that building. But for the occasional trip in here and there, I don't think that you need to worry about asking for permission for that. That's my understanding. Jeff, is that consistent with IMT's understanding?
Yeah, that sounds about right. If you're just going to pop in for picking up something, printing out something, and then heading back home, you don't need to go through all of the steps in the process. But if you are going to settle in for the day and actually work, and that's what you're going to be doing on a regular basis, please complete the return to work COVID training. We'll go from there.
So Jason, I know there's a bunch of RGS staff on this as well. Can you clarify that for the RGS staff specifically? Are they needing to go through the return to research form or work through their supervisor and our unit?
I think in terms of if it's employees going into work in the office, so the guidance I just gave there was for faculty that whether or not they have a supervisor is irrelevant, because as a faculty member, I'm going to do what I want to do anyway, right? So, and I'm speaking as a faculty member there. I'm rarely going to ask my chair if I can go into the office. If you're an employee that has an office, a cubicle or something like that, staff member, you need to make sure you check in with your supervisor and make sure that is approved. And that's especially important in terms of making sure that we don't have a bunch of people showing up all at one time, and we don't, especially if you've been in RMNC lately, I mean, it's like a sweatshop in there. It's super hot and humid, and I know they don't have the airflow up all the way. So we need to really be able to anticipate how many people are going to be in that building, I think. Does that help? All right, we're going to have another 1 minute of silence.
I'm going to break your minute of silence there, Jason. Sorry. I did put in the PSU's COVID-19 training. It was updated last December. This is not the research training. This is for all other employees returning to campus. So for standard office workers, staff, we do ask that you go through and complete this training if you're going to be on campus on a regular basis over the summer. So that's in the chat and you can go through that process.
Cool. Thank you, Jeff. I see Melissa just asked if there's specific concerns, who should they contact? If you have general questions about research over the summer, you can send them to me directly, or you can send them to research@pdx.edu, and we'll figure out who the right person to address the question is. Is that good, Melissa? Does that help? Good. And Ken, if you did the return to research training, you do not need to do the other training that Jeff just put in there. They're not exactly the same, but they're pretty close to the same. The research one has a few extra things in it, I think.
Okay, this is more for new people, so I'll
Yeah.
just get and do the research training. Thanks.
Yep. All right, I'm gonna wait like another 30 seconds, and then I'm gonna start telling dad jokes until people until people can't handle it anymore and leave. Juan, you unmuted your video. Did you want to say something, or you just wanted to say hi?
I just want to say hi.
Ah.
I got caught up with a meeting that run long, but it's great to see everybody. I hope that you guys are cool enough. 95-degree weather and going higher. So I'm sure it's beer 30 somewhere around town.
Indeed. Good to see you, Juan. All right, I guess that about wraps it up then. I'm looking through, I don't see anybody unmuting. All right, we've answered all questions. There's no ambiguity. Everyone understands everything perfectly. And the summer is going to be fun, right? We're going to get back in there. I look forward to seeing folks on campus. I intend to be back most of the summer. So remember to look this Friday in the RGS bulletin for updated FAQs. And remember, if you don't get the RGS bulletin, that you can go to our website, and Sean, it's pretty simple to find the spot to sign up, right? Oh, Sean's.
Yeah, if everybody goes to our funding opportunities page, I'll drop a link there, and you can sign up there, and you will get the bulletin newsletter.
Awesome. Thank you, Sean. Yeah, I would like to just make a plug for that. If you know others that have unsubscribed to RGS emails, suggest to them that they resubscribe again, because that's the best way for us to communicate all of these things to campus. Plus, Sean writes some pretty compelling stories, I have to say. So, all right. Well, I hope you all enjoy the rest of your afternoon. Stay cool, and we'll see you around this summer.